Welcome once again to the 17th batch of the Master Trainer Program on Healthcare Communication. Thank you for joining the program and thank you for having the interest and trust in the program. Before we go further, I think I would like to give some, technology reminders for all of us so that we all know how we have to, handle the whole program. Though I've shared the details with you on your email also. So a request to all of you to make sure that you sit in a place where you can comfortably have your camera on and have your notebook and a pen with you because although I've shared the course material with you, but there'll be a lot of points that will come during discussion. So it will be a good idea to have your, notebook and pen with you. And also make sure that you have your camera on all the time because the whole program is all about interaction. I'm just going to be a facilitator, but you all will be interacting with each other and also discussing points. So we'll be, learning by doing. So for that, we all need to participate. We all need to be available. And unless you are visually connected, there's a possibility that mentally we can get distracted, and then we may also start, doing something other than actually attending the program. So I request all of you to have your camera on and please join using the laptop and not phone because when you are on laptop, you can see everybody on one screen. That gives you a feeling of being, being together in the same space, and it connects well with the participants also. And in case if you have to move around, then you can for a second you can have your camera off and then you can move to your comfortable place. But then otherwise keep your camera on. In case if there's a call in between, try to avoid taking the call. But if it is very urgent, please make sure that you are muted and also your video is off for those couple of seconds. But keep it as short as possible because you will be otherwise, off the track. And then also keep your device on the mute mode, but you're free to speak because the whole program is an interactive program. So I expect everybody to participate and contribute. And a couple of group agreements that I want to remind here. See, we all are coming from different backgrounds. Some of you are doctors, some of you are administrators, some of you are psychologists and quality personnel. So it's a rich mix of very diverse group. And that really brings about new learning for all of us because if we are interacting with the same kind of people, then there is kind of already a bias that I know everybody and everybody knows about what we are talking. But you will get a good opportunity to see each other's perspective and also see their challenges, see their difficulties, understand how they are handling their situation. So rich mix would help us to learn about different professions. At the same time, we have to be mindful and respectful towards each other throughout the program because we all are you all are learned, you all are experienced, already in job. So you will have a lot of experience and expertise in your own area. But we have to be mindful of everybody's learning opportunity. So give chance to everyone to speak and be respectful, be mindful of their profession or their background. We have to make sure that we create a conducive environment where everybody feels safe and feels like sharing their challenges, their difficulties, because that's how we are going to learn. So this whole program is all about learning by doing. I'm going to play the role of a catalyst. Of course, I have a structure in the program, but then it is all when you will participate, when you will come up with your experience, your challenges, your learning. Although I've sent a lot of material on your email, course material, I request all of you to have a look at it, go through it, because then you will come better prepared for the session. I've also shared the list of topics with all of you in the group. Have a look at the list of topics. I have always asked the group to suggest if they think any one of the topic is not required or not relevant. But most of the times, nobody has come up with any new suggestion. But if you have any suggestion to bring a change in the list of topics, I'm open to it. And if the group agrees, I'll be more than happy to, consider the topic that you wish to be covered. As I mentioned, it's a master trainer program. So the whole idea is that we learn how to do a training program. Uh, so is that Arshia? I can see
I
Ishita.
think this is me. Yeah, that's my daughter's name.
Okay.
Let me just rename it here.
Yeah, I request you to rename with your official name because it will take all of us some time to, get familiar with each other's names. So it's better if we have our official names on the on
Yeah,
the
yeah, I've done
blog.
that. I've done that.
Thank you. Thank you.
Thank you.
Yeah. So as I was saying, the whole program has been designed with the idea that we want you all not only to learn how to communicate effectively in patient care, but also how do you impart this training to your fellow professionals. So therefore, the whole program is designed in a manner where the first two sessions will be to lay the foundation, which is more like why do we need to understand healthcare communication and what is the relevance? How is it same or different from our day-to-day communication? The second session is about developing communication competencies, particularly in with respect to patient communication and also communication with our fellow professionals. Session 3 and 4 have been integrated in the program with the idea to enhance your training skills. So session 3 is all about how do you go about designing a program. So there we will be discussing how do you design an impactful program. What are the steps that you should keep in mind when you are designing a program. And session 4 is about how do you facilitate a program. So, like we normally know that people would come with a PPT and they will do the talking and they'll show the PPT. But I think that's a thing of past now. We all know that we have to engage our audience, we have to engage our participants. So just PPT is not enough. So you need to have an understanding of how do people learn, how do people engage, how to make people interested in your program. So a lot of discussion will happen about how do you go about facilitating an impactful program. So what all you should integrate in your session or in your program so that it becomes interesting, engaging, powerful, impactful. And then rest of the 6 topics are all specific to patient communication. Like, for example, understanding patient's expectation and how do we really handle those expectations, manage those expectations. And in case if you see any unrealistic expectation, how do you address those expectations? Then, of course, situations like how to handle patients who are uncooperative, or how do you address a patient's complaint or request? Because these are intense communications where there's a risk of patient party becoming upset and aggressive, and sometimes even they become violent. So we will talk about how do you go about handling uncooperative patients, how do you address their complaints and their requests so that you create patient satisfaction and enhance patient experience. Besides that, we'll be also talking about how do you go about breaking bad news. Of course, breaking of bad news is done by doctors. So that will be discussed from the point of view how a clinician is supposed to be doing breaking of bad news. But at the same time, being healthcare team members, we all have a responsibility to participate and make sure that we behave in a manner that the whole process goes in a smooth manner. It doesn't end up into aggressive reaction or anything that is not pleasant. And then the last topic is disclosure of medical error. Even this topic is all about, to be done by doctors, but of course, errors happen in patient care by nurses, by other healthcare providers. So, how do you handle those situations as healthcare team member? And then, who would do the disclosure of medical error? If it is done by a doctor, then of course the clinician will have to do the disclosure of medical error. But then, if the error has happened by a nurse, then I think the quality person, the senior nurse, the care coordinator, the doctors, everybody will be engaged in that process. So how do we participate in that and see how we can handle that intense communication. So this is briefly about the program. And after session 4, I will be sharing a list of topics of pedagogies. For example, as a trainer, I want you to go back learning a lot of new pedagogies, like how do you use storytelling, how do you use videos, how do you use role plays, because these are the ways you actually engage your audience. So I'll be sharing a list of pedagogies. Each one of you will have to pick up one topic, anything. Somebody can pick up storytelling, somebody can do role play, whatever you like, what you are good at, what you want to talk about, that's your choice. So after session 4, from session 5 onwards, the last 15 minutes will be one presentation by each one of you. So that way, each one of you will be presenting on one topic, and by the end of the program, you will have learned 8 to 10 new ways of presenting a program or facilitating a program. So presentation, I will be giving you the instruction. It's just 5 to 7 slides, not a big presentation, but you have to do it in a manner. So you will have to prepare a presentation, get it vetted by me, and then you will be making the presentation from session 5 on. So, and after every session, I share a feedback form. I request you to complete feedback form. I've kept it very simple, just few questions to the point. And I look forward to your remarks and your suggestions, because that is what is going to improve the delivery of the program, content of the program, and overall impact of the program. That's the whole idea. So before we go into the actual topic of the discussion today, I think we should go for introduction. So I request all of you to take 1 minute and note down in your notebook what would you like to tell about you. So what I expect, please tell your name, tell your professional background, what designation are you holding, and in which hospital you are in, and then what is special about your name. So briefly, just 1 minute. You will get just 60 seconds time to introduce yourself. So I give you 1 minute to prepare, and then you get 60 seconds to introduce yourself. So you can start writing. I think Dr. Meetu, will you be able to write and present for yourself? Also, Dr. Pradeep Sharma, will you be able to write, because you are driving, I believe? Oh, Meetu is not there.
Yeah, yes, ma'am.
Yeah. So, Dr. Pradeep, you are still driving?
Yeah, ma'am. Actually, it will take 10 to 15 minutes. I'm analysis. I just got a call of LSCS. So within 10-15 minutes, I will be at home. So, but
That's
I can
okay.
introduce myself.
Okay. Okay, no problem. So let everybody finish writing about themselves, and then we'll come to you. Sure. So, Ashia, you are sitting at a place where your face is not very clearly visible. Can you sit facing the light so that your visibility increases? Although you have a beautiful background, but then you are not visible very clearly. It will be great if you can. Yeah, it's better. It's much better. Thank you. Thank you. So I hope all of you are ready. Okay, so I'll make the beginning, and then I'll pass the baton to one of you, and then you can, choose the next person to talk about. So, friends, I am Dr. Indu Arneja. I am a practicing psychologist, author, and master trainer healthcare communication. Uh, I have been into healthcare communication for the last 10 years. I've done around more than 2,000 programs, and have work with almost like 50,000 healthcare professionals, including doctors, nurses, paramedical staff, medical students, dental students, nursing students. So I primarily focus on the communication and interpersonal skills essential in patient handling. Uh, I am an author of a book, Fundamentals of Clinical Communication, which I have written keeping the medical students in mind because I work with Maulana Medical College for the last 10 years, where I am engaging with them and preparing them for patient interview and patient handling. So during COVID time, I got little time and I sat and wrote that book. I'll share the book outlook to you, all of you, so you can have a look. This is available on Amazon. We'll discuss about it later. So about me, my name is Indu, and Indu is a synonym of moon. And I take pride in, spreading coolness and light. I take my light from sun, but I don't pass on the heat. I pass on the coolness and light to my fellow people. Thank you so much. That's about me. So I pass the baton to Michelle. Michelle, please go ahead and introduce yourself.
Thank you, ma'am. Good evening, everybody. My name is Michelle Norman, and currently I work as a psycho-oncologist, and I lead the counseling team at Bangalore Hospice Trust Karunashraya in Bangalore. So this is a 73-bedded hospice, which I work and I lead the counseling team over there. I've been working in the field of psycho-oncology for the last 13 years, and this is the first time I'm working at a hospice setting where we see mostly terminal and advancing cancer patients who are going into end-of-life care. My name Michelle was given by my father, who used to travel all over the world. And France was one of the places that he had gone to, and he had heard the word Michelle. Obviously, although I am from Kerala, this name is very hard to pronounce. So most of the time people think it's Michael. So I've been used to getting bullied in school, especially the first day of school where they'll call out your name and they'll definitely say Michael and not Michelle. So definitely biblically, there is a connotation that it is related to the female version of Saint Michael, who is an archangel. So yeah, that's about me. Thank you.
Wonderful. Thank you, Michelle. Thank you for introducing yourself. Friends, I met Michelle in NABH Assessors Program. So we both are IRCA assessors. IRCA is Integrated Rehabilitation Centers for Addicts. So incidentally, I've done my doctorate in, my subject in my doctorate was drug abuse. So I had worked with drug abuse patients. So Michelle and me, we both took that training and we did assessment for a lot of addiction centers, de-addiction centers. Yeah. Thank you, Michelle, for joining the program. You have been following up for almost 10 years, and this is now you could make it. I'm glad that you could come in. Thank you so much. So whom do you nominate after you to speak?
Maheshwari?
Thank you, Michelle, for nominating me. And I'm Maheshwari, and I'm working as a joint director in a family-run hospital in Salem, which is in a 100-bedded hospital. And we have all scope of services, but we are a master in nephrology and urology and neurology. So we have a family doctors in our family, and my father-in-law and my brother-in-law is a doctor. So I'm part of the administrative team, and I help my husband in the administration part. But still, I have to deal with the operations with the clinical part also. Because since as and being an administrator, everything depends upon the communication and how people deal with patients and everything. So I'm into all the day-to-day operations, especially people manager. I deal with all the residents who work in our hospital. And my name is Mahesh, and basically I'm from Chennai and got married and settled here and moved on to Salem. And my name is Maheshwari, and Maheshwari's name is like goddesses Durga. The name is like my dad and mom had kept me such an old name, but still it's fine. Yeah, that's it about me, and being very happy to be a part of this program, and let's embark together. Thank you.
Thank you, Maheshwari, for introducing yourself. Thank you. You were the first one to quickly enroll for the program. I mean, somebody asked about the program, and then I saw you had already registered. Thank you. So whom do you nominate after you?
Harshia Bandari.
Yeah,
Harshia?
Arshia. Thank you.
Yeah, thank you. Thanks, Maheshwari. So I'm Arshia Bhandari, and I work with the industry. I work in the field of pharmacovigilance, and that's exactly what got me interested into the field of patient safety and how important it is to have patient centricity, in healthcare. And I think last 2 years back, I started an organization called PHV Fit, which is kind of a thought leadership forum that works towards creating patient safety awareness. And I've been speaking with at different forums on patient safety awareness and pharmacovigilance. That includes Pharmacovigilance Program of India, Ministry of Health and Welfare. Then, I've spoken on patient safety and pharmacovigilance on, other different forums in hospitals as well. And what got me interested into this program was, the focus on communication with patients and how it can really affect, the care that the patients receive. And I'm very happy to be here amongst, the health professionals working in this field. I mean, being on the ground doing the real work, and it'll really help me understand the challenges that healthcare professionals really face towards patient centricity as well. So my name, Arshia, it means belonging to heaven. And it used to be a very uncommon name. I was the only one probably in the whole city who had this name at one point of time. It has increased now. It looks to be a Muslim name. I'm always asked, okay, is it, so yeah, but it's an Urdu word. Yeah. So that's all about me. Thank you so much.
Thank you.
Yeah.
Thank you for introducing yourself. So, whom you nominate? I think Shikha is visible to you, so you can.
Yes, Shikha.
Go ahead.
Thank you, Arshia. Hi, everyone. I am Shikha Bhargav. I am from Delhi. I work with the ABAS, Institute of Human Behavior and Life Sciences. It's an hospital, neuropsychological hospital that deals with neuro patients and psychiatrist patients. I've been into this sector for around 15 years. I have a profile where I worked with hospital administrators. I myself was an hospital administrator, then quality manager, then trainer in the hospital. I've dealt with doctors, various cadres, doctors, nurses, paramedics, housekeeping staff, attendants, every cadre of the hospital. What dragged me into this program is I actually wanted to know more about the communication, because I'm dealing with the people who actually needs this communication skill. Why? Because everyone knows how people deal with the patient and their family members. Because I am dealing on the ground, I know the gaps, I know what people are facing, the patient side also. Like ma'am said, that's we will be dealing with the end of life care, how to break the bad news, or about the medicine error. But there are other things also, like I dealt one situation where somebody commits suicide. So how to tackle with that problem, how to tackle with that situation. That was very difficult at that moment of time. But now I understand why these communication skills are very important to each and every cadre of the hospital. That's why I want to be into this course, learn this program, and then I want to make the people aware about all these things. Because being into healthcare sector, it's very, very important for each and everyone. As ma'am said, she has written one book also. I think each and every, again, MBBS student, everyone should learn this and read that book. So my name Shikha means mountain peak. So I can't go on that top, but I just, along with me, I will take everyone to the top of the mountain with our knowledge, and make people aware about all the things that I know. So that is my motive of my life, actually. Thank you.
Thank you, Shikha. Thank you for introducing yourself. So, can I request Dr. Sharma to please introduce yourself, Dr. Sudeep Sharma? Dr. Pradeep, if you're comfortable, you can have the audio on. Otherwise, once you reach back and once you're comfortable, you can have your camera on and then you can introduce. It's okay. I think he's not able to.
Hello.
Yeah. Yes. Go ahead,
Yes, sir.
please.
Yes, sir. I'm Dr. Pradeep. I'm basically anesthetist, and I did my graduation and post-graduation from Delhi University, from University College and MMC. I'm into the practice for last around 20 years as an anesthetist and intensivist. Why I have joined this program? Basically, it's a effective communication. It plays a very important role in with communication to the patients, family members, and our colleagues also. And my other motive is I want to impart the knowledge what we people have gained, what I have gained in last 20 years to my fellow members regarding just like I had given BLS training also to the school students, to the hospital workers. And I want to, the second one is I want to tell the other people about NABH also. So what are the different chapters? How so it will make me better. This course will make me better to communicate and to present in that way. And the name is Pradeep. Pradeep is basically who lightens, who gives shine. That's the meaning of that. Thank you.
Thank you so much, Dr. Pradeep, for introducing yourself and also joining the program, because you joined at the last minute. So, and you'll be glad to know that I'm also one of the guest faculty for the NABH Assessors Program. So very regularly,
Okay.
whenever there's an assessors program by NABH, I am invited to talk about essential communication and interpersonal skills for assessors. So
Thank you, ma'am.
yeah, and there also I think the importance of communication, because you have to build rapport and then you have to make your team comfortable and do the assessment in a very objective manner and a professional manner. So we this just last month I was there for 2 programs for NABH. Thank you. Thank you. I think
Thank
Dr. Pradeep, you are NABH assessor also, if I'm not mistaken.
Yes, ma'am. Yes, ma'am.
Dr. Pradeep is also NABH.
Mm.
Thank you. Going further, I think Mitu is not here. She's working with 1MG. Again, she has been in touch with me for last good time, but somehow she could not join. But this time she joined the program, and I'm glad that you all joined, because after this batch, I'm going to put a hold for a few months, because I have a couple of other projects on at hand, and I was not, I will not be able to balance 2 things. So I thought I'll just call this as, for the time being, the last program, and then maybe after a few months we will start with the next batch. So I'm glad that you all of you could make it. So today's topic of discussion is what is the importance and relevance of communication in healthcare. So what has changed in the last couple of decades? Earlier, we never talked about communication, or there was no formal training. If you look at medical curriculum or nursing curriculum, or for that matter, any healthcare providers curriculum, I don't think we talked about these skills as one of the required skills. It was assumed that we already know and we could do it. So if I ask you to write in the chat box, what do you think has changed in the couple of decades that we need to talk about communication and interpersonal skills? Write in the chat box. You could just write 1 or 2 words, and then maybe, if need be, we can ask you. Or if, okay, empathy has declined. Yes, Maheshwari, I completely agree with you. I think that's one thing that is bothering everyone. Empathy has declined. That's usually what patients are complaining about. What else has changed? More lawsuits against healthcare. Yes, absolutely. I agree. Interpersonal problems. Okay. Even among fellow professionals, even that has changed. What has changed between us and the patient. Teamwork has gone down. Yes, we are now working in silos. We like to work in very specific areas. We don't like to collaborate. We don't like to share with others. Absolutely, I agree. And with patients, what has changed? Like you said, empathy has gone down. Yes, patient counseling is needed, but we are not used to it because we never thought that that's also required. Awareness about health culture. Yes, people are now more aware. Is that's what you want to say, Chika? People are more aware about about themselves, about diseases. Yes, I agree. Trust has gone down. Is that what Maheshwari you want to say? Okay, yes, absolutely. Absolutely. Then patients are more aware and need more information. Absolutely. I think patients are knowledgeable now. There is no doubt. People are now more educated, and especially when they have information just at the click of the button. The moment you say, oh, you seem to have, renal calculi. So you just have to say, कि आपको पथरी है, and then they will just open the Google and they start searching and they will have the answer, then. Absolutely. Yes, medical legal problems have increased tremendously in the last few decades. I think that's something really worries us, and that has really, brought us to a point where we really need to introspect what is happening and how do I really reverse the situation. Absolutely. I completely agree. I think most of you have covered almost all the points. Let me share the presentation with you and also start the discussion simultaneously. What has changed and why do we need to communicate effectively with the patients? Give me 1 second to start the presentation. Yeah. Are you able to see oh, this is technology element. Sorry. So are you able to see the screen? It's still loading, I know. Yeah.
Yes.
Okay, great. Yeah. So actually, practice of medicine was much simpler and easier earlier. I mean, I don't think we ever had any problem maybe 20, 30 years ago. Whatever we did to the patient, they were happy. They were always thankful. They always actually saw this profession as godly work, So they always respected doctors and healthcare professionals as gods, actually. But things have really changed drastically in the last couple of decades. As you have listed in the chat box, people have become more aware. Their demands and expectations also have gone up because earlier healthcare were mostly, kind of a social service or philanthropic service. People never expected money or revenue in return of this service. But today we all know with the corporatization of the system, we are charging patients like clients. Therefore, they also have expectation that I want value for money. And if I'm paying you, then I need to get what you promise me. As a result, our answerability has gone up. I think aggression and stress is also on the rise. And it is not just among the patient. Even we as healthcare providers are more aggressive and stressed out because of various reasons. Maybe the working conditions are not good. In government sector, if you go and see, workload is a lot. Working conditions are not good. People are not very well behaved. And especially in a lot of government hospitals, we primarily have patients who are from very lower socioeconomic strata, not very educated, not very well versed with the healthcare delivery system. So, all in all, it adds to the stress factor of healthcare professionals and also to the patient party. As a result, the patient hospital conflict is on the rise. We never heard of these things earlier. The respect society had for healthcare providers was so much so that they could never think of arguing or answering back or becoming violent with the healthcare providers. But we all know how the situation is really, completely reversed. Even the media participation is not in our favor, isn't it? You must have seen a lot of small issues get exaggerated and over, explained in the media, and mostly the healthcare facilities and healthcare providers are shown in a very, very poor light. And as a result, I think the even image of the healthcare delivery system is completely tarnished, be it government sector and be it private sector. I think in both sides, that is the reality. As many of you have mentioned, the problem of litigation is definitely on. No doubt about it. We never heard any patient party, now litigating the hospital or the doctor, but we get to hear this very often now. So people are going for indemnity, insurance, so that in case if there's any legal action on them, they are protected. Even the extent of fights have changed. Earlier, it used to be usually verbal. In case if that happened, it used to be only verbal. But now we have seen so many, incidents where the patient party comes and damages the hospital infrastructure. They break things and they start fighting with doctors and nurses, and physically also, start fighting and beating healthcare providers. So these changes and a lot of incidents have been shared with me by many healthcare providers. For example, I was taking a session at the Delhi Secretariat. So one of the medical superintendents shared his experience that his resident was about to get into argument with the patient party in the emergency care. But there were people around and they stopped and controlled the situation. Everything, was managed at that point of time. But incidentally, when the resident was going out of the hospital, the patient party was waiting outside. They caught hold of the doctor and, physically beat that doctor. And he had almost 15, 16 fractures, on his body. So you can well imagine the kind of fight now, we can face, or the kind of violence that we can face against us. So therefore, I think these changes in the doctor-patient relationship or healthcare provider-patient relationship brings us to the point, am I communicating effectively? And a lot of studies have shown that when you have good rapport with your patient, you're less likely to receive any aggressive reaction coming from your patient party. So I was taking a session for a group of gynecologists. So one of the residents, she shared her experience. She said in her department, they delivered a schizophrenic mother. She delivered a normal, healthy, male child. During the delivery, they allowed her husband to be with her because they thought that he will be able to help in managing the patient. So after the delivery, the mother was moved to the ward and the husband was asked to wait outside, because normally in female wards, we don't allow the male attendants to be with the patient. They, of course, allowed a female attendant. So at night, after breastfeeding the baby, the mother took her medicine and she went off to sleep. So in the middle of night, one of them, maybe the patient or the attendant, they saw the child had turned blue. They really were shocked. The same resident was on duty. She was called immediately. She picked up the child and she rushed to, an ICU. She tried to resuscitate the child, but unfortunately, they could not save the child. The same husband was so well behaved, so cordial with everybody during the delivery time in the labor room, completely became aggressive and insane. He started hitting people, he started throwing things, he started abusing people and breaking things around him. So this resident, she said that only one person with whom he wasn't misbehaving or was not aggressive, that it was me. Because during her, stay in the labor room with her husband also around, they developed that rapport and understanding, the impression that the doctor had that she's a caring doctor. She's nice, she's well behaved. So it is individual skill. Of course, it has collective power. There's no doubt about it. But I think that's one area we need to focus. Am I communicating effectively? And a lot of studies have shown that if you communicate effectively with your patient, then you're less likely to experience violence against. Let's see, what do studies say? Surprisingly, studies say that our communication with the patient is inadequate. We do not communicate enough. So this is a study by Institute of Medicine. They found out that we as healthcare professionals, clinicians, we lack adequate communication skill training. And you will all agree with me because till recent time, there was no formal training, even for doctors. 2019, they introduced a module called ATCOM module, that is Attitude, Ethics, and Communication module, which is now being delivered to the medical students from year one. They've integrated with the new curriculum for the medical student. So from year one, now they're getting all this part by part, so that by the time they are, they're graduate and they start handling patient, they have the right attitude, ethics in place, and also they have a deeper understanding of communication skills. So, but I don't think in all other professions like nursing or for dietetics or for physiotherapy or all other branches, I don't think still we are formally integrating this as a curriculum for their undergraduate or postgraduate program. So as I said earlier also with Maulana Medical College, for the last 10 years, I work with the final year students. So before they go for internship, they have to attend 6 hours mandatory training with me, where they learn how we go about conducting patient interview and handling patient interaction. Although these 6 hours are not enough, then at least something is better than nothing. So with that idea, we are trying to empower them with whatever little skills they can provide. But studies constantly remind us that we are not communicating enough with our patient. In another study, when asked, 75% of the orthopedic surgeons believed that they communicated satisfactorily. But when their patients were asked, only 21% of the patients agreed that yes, our doctor communicates effectively with us, or he communicated effectively. So this is a recent survey in India done by ICC, CRMAA, and Teragini. It was done in 2019. So according to this survey, 45% of the patients and their family members reported that they had inadequate clarity even about the diagnosis. They didn't understand what their disease was. Also, at the same time, they didn't understand much about the treatment and the care options available to them. See, we are so much in habit of deciding on the patient's behalf. Of course, the knowledge and the experience and expertise clinicians have, it automatically, occurs to them what would suit best in this situation. But at the same time, now patients want to know what are the options available. They even want to participate in choosing what will work best for them. But incidentally, if you look at the practice, we still decide on patients' behalf and we don't give them details about the options available. They also felt that there was a lack of involvement in deciding the treatment option. They felt unempowered in the treatment of their patient, and they also reported rush consultation. So they felt that whenever they tried to consult their doctor, they did not get enough opportunity or time to address their concern. Almost 1/3 of the patients and their family members even said that they were not allowed to describe their condition or symptoms. So a lot of time we are in hurry because of shortage of time, because of the workload, or because we have been very quick to make a diagnosis. So we think, I know what it is. For example, if a patient comes with a shoulder dislocation, I think from this we can make out that this patient has shoulder dislocation. So we would not care much to ask what happened, how did you have this, so how this whole thing happened. So we know it's shoulder dislocation and we need to, do the treatment. But the patient wants to talk about their condition, because when they are able to tell about their symptoms or tell about their condition, it gives them an opportunity to narrate their story and also relieves them of the burden that they carry. But incidentally, for various reasons, we do not give them enough chance and opportunity to speak about their problems. Also, almost the same number said that the doctor did not straightforwardly address their issue. A lot of times they want to know what it could be. Why did this happen? Can I take Ayurvedic treatment? Can I go for some alternative medicine? Can I avoid surgery? How much is the financial, implication? I hope there is no relapse. I hope there is no complication. So these are their concerns. But maybe we are not very comfortable answering all those things in a straightforward manner. We are not used to it. We have not learned it. So as a result, they feel that their questions are not, effectively handled. If I may ask you, if we learned how to communicate effectively. So although I'm talking about doctors, this study talked about doctors, so I focused on doctors. But I think as a healthcare provider, anywhere, you are interacting with the patient. If I'm at a front desk, I'm interacting with my patient. If I'm a nurse, I'm interacting with my patient. If I'm a care coordinator, I'm interacting with my patient. So we all are communicating with the patient, and patient sees all of us as healthcare providers. They are hardly able to actually differentiate who is a doctor or a nurse, or they are able to feel that, okay, everybody is from the hospital, so they are more knowledgeable and more understanding. So if we learned how to communicate, how do you think we will be benefited? Forget about the patient or even the hospital. How do you think we will be benefited? You can write in the chat box, and then maybe I'll ask you to unmute and elaborate on your point. But I want everybody to write answers in the chat box so that I can get to see what is your understanding. How will you be benefited if you learned how to communicate effectively? I'm sorry, I forgot to make an announcement. Please feel free to have water, tea, coffee, juice, anything during this session. I know after a long day, you are sitting in front of the camera, and I don't expect you to sit straight like this. You can comfortably have tea, coffee, juice, water. Don't eat food, but at least drinks you can have, because I know you feel like replenishing your energy. Yeah. So could make myself understandable to others. Yes, if I communicate effectively, people will understand me better. Of course, there'll be less misunderstanding. Yes, trust will be built, which is very important. See, today I think we are struggling to earn patients' trust. Patients are going window shopping. They don't trust us if we say you require surgery or you require this intervention. They will definitely want to go for second opinion. So yes, building trust is very important. So Michelle has written, it will be helpful to regulate my emotions and act in accordance with the situation. Definitely, if I'm communicating effectively, then I think I will also have good control on the expression that I have, which includes my emotional expression. Absolutely. I can develop better rapport and trust. Absolutely. And that's the cornerstone of your patient care. See, if you are able to build rapport, half the job is done. If you have been able to earn the patient's trust, after even you tell them all treatment options, if the patient has trust in you, very usually they'll say one thing. What do they say? Can somebody guess? If your patient has trust in you and you suggest them number of options that we can go for surgery, or we can wait and we can start with medicine, and let's see if medicine works, then maybe we can, put surgery on hold. So what do normally patient and their family members will say?
Whatever you think is best.
Yes, whatever you think is best. It's all in your hands. आप बताइए डॉक्टर साहब मेरे लिए क्या best? आप suggest करिए. But now that trust has to be earned. Yeah, I believe you. So that means they show that trust. Oh, you're like God to me. I trust you, and I want you to take that decision, my dear. डॉक्टर साहब आप बताइए जो मेरे लिए बेस्ट है वो मुझे बताइए. So that's how they will normally say. So very true. If we learned how to communicate effectively, I think it would first of all, help build trust. It will be easy also to, communicate with your patient, because if the patient does not have trust, first of all, it creates uncomfortable feeling in ourselves. The other person is not trusting. And then you will make all efforts to create that trust. But if you know the patient trusts you, then you can be in your natural self, and then you can, talk to them in a very honest and transparent manner. Automatically, they will believe your words, and it will be easy to navigate when it comes to treatment or intervention or whatever you want to set in. And of course, you will feel happy about what you do. But much more than that, if I tell you, a lot of medical errors happen because of poor communication. If we communicated effectively, actually errors will go down. I think that is one of the most important benefit to us as healthcare workers. You may not be knowing any idea how many errors happen in India. Can you guess how many errors happen in India? Just guess. It is considered safer to fly and safer to work in nuclear industry than to get admitted into any of the hospitals. It's not just in India, across the world I'm talking. 1 is to 33,000 errors. We make 33,000 errors, and then you'll get to hear about one error in the, aviation industry or in nuclear industry. So according to JCI, medical errors are the third commonest cause of death. I repeat, it may be something very new to you. According to JCI, medical errors are the third commonest cause of death in US, a country that seems to be working very meticulously, where there are limited number of patients and they are working in a very systematic manner. We haven't done any study in our country. You can tell me better where we will stand if we did a similar study in our country. Professor Ashish Jha from Harvard University, he did a study and he estimated 5.2 million errors happen annually in India. I would say it is underestimation. It must be much more than that. So medical errors like wrong site surgery, wrong medication, wrong organ removal, wrong treatment, wrong patient, they're very, very common. And most of the errors are around medication error. So Arshia, this would interest you. You talk about pharmacovigilance, so you can see maximum errors happen around medication. And of course, a lot of errors happen about patient care, surgical things going wrong, and then of course, infection that we give to our patient. 60 to 70% of these errors are a result of poor communication. This is not me who is saying, I'm just giving you the references, the studies that talk about errors. And most of these errors are because of poor communication between us. We don't communicate effectively between us. So I'm going to do a small activity with all of you. Since we are a small number, I'll be sending 4 of you to the waiting area, and then I will call or take you in one by one. So I'm just sending 4 of you out in the waiting area, and then I'll get you in one by. Give me a second to send you in the waiting area. Arshia, I'm sending you. Maheshwari, I'm sending you to waiting area. Michelle, even I'm sending you to the waiting room. And Shikha. Okay. So, Dr. Pradeep, you're with me. I'm going to show you a slide. I want you to read that and then let me know when you are ready. Give me a second to share the screen. So is this slide visible? Let me know when you're ready. Are you ready?
Yes.
Okay. So I'm stopping the sharing of screen. I'll be getting one of the participant in, and I want you to explain whatever you have read on this slide to the next person. So I'm admitting Michelle. I request you to share whatever you have understood from this slide with Michelle. So let me just tell her role. Okay. Michelle, uh, Dr. Pradeep has a set of information.
Okay.
He's going to share with you. So please listen to him carefully. Dr. Pradeep, please go ahead.
Yeah. Good evening, Michelle. I'm Dr. Pradeep. I'm looking after your patient, and this patient has underwent surgery, cardiothoracic surgery of calcified tumor, and after the procedure, this patient has developed a bit numbness below the nipple. So we had to take neurological consultation for that, and these things may resolve during the course of the time. Hello?
Yes.
Yes. So these things will resolve by the course of the time. So otherwise, your patient is fine, and the patient is maintaining vitals, and the investigations are on the better side. So anything do you want to know?
You mentioned something about neuro.
Yeah, this basically during the procedure, there may be some because we surgeons had to take out the tumor, so there could be some nerve entrapment or some superficial nerves can be involved. So, but we had as it's a could be as it's an oncosurgery, so we had to take out the tumor, so we can't leave that. So during that part, there may be some involvement of the nerves. So that will be cured, or that will be uh, better by the time.
So you're saying everything is going to be okay.
It will take them, but in 5 to 10% that it could be there permanently also. But I think in 90% of the cases it may get better. Or
And
rather, a neurologist will come, and that person will tell you better.
okay. So we'll have to wait till the neurologist comes to
Yeah,
get a
please.
better understanding.
Okay. So I'm going to get the next person in. So now, Michelle, you will be doing the talking. And then the next person and the next person. But meanwhile, I want both of you, because you, Dr. Pradeep, you are the first one, and Michelle, you are the second one, to note down what has happened to the information. What has changed? Because Dr. Pradeep has shared some information with you. You are going to share with the next person. And the next person, when they share what changes, I want you to observe that. So I'm taking in Maheshwari. So I want you to explain to Maheshwari. And now, Dr. Pradeep, you will not be doing the talking. Michelle will be doing the talking. So Maheshwari, Michelle has a set of information. She is going to share with you. Please listen to her carefully. So Michelle, please go ahead and explain whatever you have understood from Dr. Pradeep.
Hi, Maheshwari. I have some information that I'd like to share about your patient. So they underwent an cardiothoracic surgery, and there was a incision made just below the nipple, and some of the nerves have got affected, but this is something that would take a sizable amount of time to get better. So in 90% of the cases, there usually aren't any issues and the person will come back to regular functioning. But we will get a neurologist in to get an opinion and also get some clarity on the situation. Is there anything you'd like to ask?
Can you repeat the last two thing? I couldn't hear you properly.
Sorry, so I said
Hello?
90% of the time, these issues will get resolved, and we would be getting a neurologist in for a consultation to understand the situation better.
So Maheshwari, are you okay? Have you understood? Okay.
Yes.
So now I'll be taking the next person in. So Maheshwari, you will have to now explain whatever you have understood from Dr. Michelle, from Michelle. And then now Michelle and Pradeep, Dr. Pradeep, you will not be doing any talking, but you will be just observing the change. Give me a second to bring the next person in. Okay, so I am taking in Arshia. So Maheshwari, you will be talking to Arshia. Give me a second. So Arshia, can you please have your camera on? Okay. So Arshia, Maheshwari has a set of information she's going to share with you. Please listen to her carefully. Maheshwari, please go ahead.
Thank you. Ashya, I have an information about a patient who has undergone the cardiothoracic surgery, and he has a recession below his nipple, and nerves are also have got affected. And 90% of these cases, of 90% of the time, these cases can be resolved, and a neuro consultation is required for detailed information about this.
So Arshia, have you understood?
Yeah, I got it. Yeah.
Okay. So I'm admitting Shikha, and now whatever you have understood, you have to explain to Shikha. So meanwhile, Dr. Sharma, Michelle, and also Maheshwari, please keep noting down what changes you are observing in the information that is being communicated.
Can
So,
I,
Arshia,
Dr.
yeah,
Sharma,
yeah.
can I have this information once more? Because
Sure.
yeah, I think it'll be nice to for me to note.
Sure. So
Yeah.
Maheshwari, please go ahead. Yeah.
There's a patient who has undergone a cardiothoracic surgery today, and there is a recession below the nipple, and the nerves are also had got affected. 90% of these cases can be resolved. Issues can be resolved, and though we need a neuro consultation is required for this case.
Okay. Yeah,
Okay.
thank you.
So I'm admitting Shikha, you have to explain whatever you have understood to Shikha. Okay. So Shikha, Arshia has a set of information she's going to share with you. Please listen to her carefully. Arshia, please go ahead.
Okay, sure. Yeah, so Shikha, this is a case about a patient who has undergone a cardiothoracic surgery. There's a recession below the nipple, and the nerves have also got affected. The 90% of these cases can be resolved, but a neuro consultation might be required for the patient.
Okay.
Shikha, have you understood?
Yeah, there is a patient who's cardiovascular, cardiovascular patient, and some problem is there.
Okay.
Okay.
So I'm admitting Shikha, you have to explain whatever you have understood to Shikha.
Yeah, there is a patient who's cardiovascular patient, and some problem is there. Okay. So I'm admitting Shikha, you have to explain whatever you have understood to Shikha.
Okay.
So there's a patient who's undergone a cardiothoracic surgery.
Okay.
He's experienced recession below his nipple
Okay.
and below her nipple, and the nerves have also got affected.
Hmm.
Though 90% of these cases resolve, but a neuro consultation might be required for the patient.
Okay. So do I need to counsel the attendants or the patient?
So Shikha, whatever you have understood, you have to repeat for us.
There is a patient who is having some cardio issue, having some problem, some below nipples, there are some nerves issues, and they have the 90% of the cases, people things get resolved, and the patient requires neuro reference.
Okay. So before I show you this slide, I want to ask all of you one by one, what changed in your message? 1.1%. So each one of you will tell 1 point that has changed.
Few terminologies.
Okay, terminology. So for me, I will say the name we completely missed. Anybody knows the name of the patient? No. Age, sex, ward, ICU, bed number.
One.
You knew it, but it didn't go to anyone. Okay, diagnosis.
Calcified tumor, I told them.
There's
You
no
will not be
diagnosis as
speaking,
well.
Dr. Pradeep, because
Oh,
you.
sorry.
No, it's okay. It's all right. I just want to tell them where are they. Diagnosis, surgery. What surgery was done? Who did the surgery? And what is the complaint? And what has happened? Friends, I shared with you a real life case. I'm going to show you this slide, the information that was shared with one participant. So this is not to blame anybody that you don't communicate well, you did not communicate well. Anybody who had been in this position, this is how we communicate. And once you will see the outcome, you will see how we make blunders in communication. So let me first show you this slide that was shared with the first participant, and then how the whole information got messed up. I'm so sorry. Yeah. So all of you can have a look at the slide that was shown. Let me know once you have done. Done? So this is a real life case that I shared with you. And you know what was the outcome? The seriousness of the situation got lost in the transit of information as the information got corrupted. Neurologist came to see the patient after 16 hours, and the patient suffered irreversible paraplegia. And the age of the patient is 21 years. So you can well imagine, at such a young age, he went into a complication which could have been managed if we had communicated effectively. We normally say it is the patients who do not know how to communicate. But very honestly, I think this particular activity should open your mind to the idea that we also do not communicate effectively. So if I may ask you, what could have been done, for example, for them to not have had to not let that have happened? What else could have been done by them and their team?
Urgent neurologist opinion referral.
So that means the person who was communicating in first instance would have repeated the message. Please call the neurologist urgently. Please call the neurologist urgently. Okay, that's one. Then what else? What more could have been done to prevent this error, this damage? Others?
We have
The
called.
receiver of the patient should have been more attentive
Who?
when the receiver of the patient. I mean,
Patient's attendant?
yeah, no. Healthcare provider.
Yeah, the person who was receiving the information should have understood the message clearly or clarified with the doctor. Second could have been that after what Dr. Shetty could have even called directly to the neurologist. If you know it's such an urgent need, he could have directly called his colleague saying that either send one of your resident or somebody who can, look into the case. We could also recheck after half an hour. Has somebody seen the patient or not? 16 hours and no follow-up from any side. Now, if the patient party comes and complains again, we get irritated. Why are you coming again and again? We have so many patients to look after. You are not the only patient. This is not a very big thing. But then, this is a big thing. In another real life incident, a lady, she delivered a normal, healthy child. She was moved to ward. I'm talking about a government hospital. The husband of that patient was hospital employee. And after a while, the lady felt that I'm bleeding more than normal. She asked her mother-in-law to go and inform the nurses or the doctors who are there on the, nurses station or the doctor station. She went once, she went twice. Somebody came to saw but did not realize the seriousness of the situation. By the time they realized, the lady had gone into PPH. After a lot of efforts, they lost the mother. In spite of all the efforts, they could not save the lady. So what I'm trying to say, when patients complain, when patients tell us their problem, and we don't listen to them carefully, errors happen. Patients' complaints need to be taken seriously. Most of the errors that happen in patient care are because of lack of coordination between us. We don't coordinate with our team members. We are working in silos. Specialties, super specialties. And there the patient, is treated part by part and not as a whole. Any idea? In a simple blood investigation, for example, if there's a patient admitted under your care, for a simple CBC, for example, how many people handle that patient's information? How many people are involved in that simple activity? Any idea?
3.
Sorry?
3.
Okay. What do others say? Okay. Shikha also says 3. What do others say? Guess.
3 itself, 3.
Who are those 3?
One is the person who will take the blood sample,
Mm.
is transferred to the investigation team,
Mm.
and then it goes back to the doctor.
So I was taking a session for a group of nurses. Sorry. Yes, please.
I think 5 or 6 people.
Yeah, it's 5.
Okay. I'll give you an example and then we'll count the number of people. So I was taking a session for a group of nurses. So one of them said, I asked one of the, no, it was not nurses, it was again residents. So he said, I asked my intern to, go and collect blood sample for one of the patient. He collected the blood sample and the report came in and we put the report in the patient's case sheet. So we were discussing in the morning round, we were discussing about that case. And the patient said, my blood sample was never collected yesterday. Everybody was surprised. How is it possible? There's a report attached to your file and you are saying my blood sample was not collected. So when they went into the details, you know what came out? Patient of bed number 6 was sitting on bed number 7. Without confirming the identity of the patient, the blood sample was collected. Assume that he is patient of bed number 7. His blood sample was sent. Report came in and it was attached to the other patients. So, if I may tell you how many people get involved, one is the person who is ordering this blood investigation. It could be the resident who is noting down orders. It could be the intern who will take the blood sample. Then it could be the person who is going to go and give the sample to the lab. It could be either the patient's family member or it could be one of our hospital staff who normally goes and gives the sample. And then the person who receives there, then the person who would do the testing, then the person who will do the entry in the register, and then finally the person who will deliver the report and then attaching that report to the file. So it could be anything from 8 to 10 people who would get involved in a simple activity of blood investigation. And that many opportunities of error. In an average stay of 3 to 4 days, patient's information exchanges how many hands? Guess now. Guess.
5 or 6?
No. In every.
This is the only class where you can take wrong guess. You can give wrong answers. You're free to give wrong answers, but you have to answer.
6 or 7, yeah.
More than 20, 25, 30.
50
Yeah.
to 60 hands.
3 shifts, 3 nurses, then doctors, at least 2 doctors,
And how many?
then
Consultant,
How many
then
residents?
consultant and referral,
ARs, residents,
referrals.
ward
Bill-
boys.
Yes. And that many opportunities of error. So this should open your mind to the idea that error can happen anywhere. Transfer of patient, transition of care is considered Bermuda Triangle of healthcare. When you move the patient from one care area to another, for example, moving the patient from OT to ICU, from ICU to room, from emergency to OT, these are all the places where most of the information gets lost. 70 to 80% of the information gets lost in the process of transition. Most of the errors happen during that. Because when a patient comes in, we don't look at the complete information. We only look at the last page. What are the immediate orders? What has to be done? That's all. And we don't look into the complete detail.
We don't have the habit of writing also.
Yes, we'll be talking about documentation errors once we'll cover that point, but you're very right. A lot of errors happen when we don't document. I remember one of the gynecologists shared her experience that in general emergency, a patient came in labor pain, full term. The resident on duty, she wrote magnesium sulfate, injection magnesium sulfate, and moved the patient to the labor room. The patient was given the injection, but unfortunately, they forgot to document that injection has been given. Patient was moved to the labor room. Whoever received the patient, they thought these are the orders from the emergency medicine. We have to give injection. They gave the second dose. The patient received double dose. I don't know how many of you know, double dose of magnesium sulfate causes. Dr. Pradeep can enlighten all of us. It causes.
It may cause muscle. It increases the muscle relaxation part, and then
Respiratory.
it can cause arrhythmias also.
Yeah. So it caused respiratory depression in her case. Yeah. She had to be moved to the ICU for management. With lot of struggle, they could save the mother, but they lost the child. So what I'm trying to say, that's how errors cause lot of damage to the patient, lot of harm to the patient. I think communication between us is most important just for the patient's sake. And if we communicate it effectively with team members, automatically there'll be better coordination between us. You know, in most of the cases, patient safety and continuity of care is our responsibility, and error happen because of poor communication between us. When you say something to your nurses and they don't understand, they may not have the courage to ask you to repeat it. They'll be scared to ask you. Either you will laugh at them or you will, shout at them. They will never clarify. So I was taking again a session for a group of residents. So one of the residents shared that his consultant speaks very fast and he's not able to note down all the orders of the consultant, but he's too scared to ask him to stop or to repeat or to slow down. I asked him, how do you manage? There can be an error. He said, then I asked my other colleagues, kya bola tha, kya bola tha, kya bola tha? And then I note down. Imagine this. So having that coordination between us, that comfort and that psychological safety that I can raise my concern, I can ask, I can request to clarify, I can request to repeat. A lot of time we shout at our residents in front of patients. I see consultants who are very senior in position, and if they're short-tempered and aggressive, they don't hesitate shouting on their interns or their residents in front of the patient. Your intern and resident will never have confidence to ask or clarify anything. So if we want that safe culture, patient safety culture, we have to create a conducive environment where people feel free to ask for clarity. Effective communication also reduces the risk of litigation. Studies suggest in almost 2/3 of the cases where the patients sued the hospital or the doctors for medical negligence, the problem was not medical negligence, it was communication failure. They were dissatisfied with the way they were communicated, or their concerns were answered or not answered, or they felt that the whole process of interaction was very, unempathetic or very rude or very aggressive. So just sometimes to teach a lesson, to take revenge, they would file a case against the hospital. If we communicated effectively, not only the litigation problem, but even the violence problem will go down. Again, you will agree with me, if you will go into the root cause of violence, it is usually the communication failure. And it is not the communication of the doctor alone. All of us, for example, in AIMS that happened, a girl, she fell from the rooftop. A young girl, she was playing on the rooftop, I think 8-10 years old girl. She fell from the rooftop and immediately people picked her up and rushed to the hospital. A lot of people, the moment they got to know that there's a girl who fell from the rooftop, everybody became, curious to know and concerned about. So a lot of people came to the hospital casualty. They took the patient in, and others also wanted to go in. The security guard who was standing on the gate, he was aggressive in stopping the patient path. Of course, you have to control people from going in. You can't allow 10, 20, 30 people to go in the hospital emergency. But the way he handled the mob was very aggressive. In return, the family also became very aggressive. Not only they hit him, but they hit a lot of people and they damaged a lot of furniture. And so a lot of time, the initial interaction, again, I was taking a session for RML Hospital, Delhi. So very senior pediatrician, I think he was head of the department. He shared that there was a child admitted in the pediatric ward. He was diagnosed with cancer. They knew that they will not be able to save the child, but then of course all effort is made to see how we can look after the child. So they were trying to intubate, but because pediatric intubation is not easy, so they called the intensivist and they said, you do the procedure. The moment he came in, he saw a lot of patients, attendants standing outside with around the bed, 5, 6 of them. And he shouted in a very loud voice and he said, "Kya tamasha bana rakha hai? Ye kya drama ho raha hai? Ye itni bheed lagai. Chalo baar. Get out, everybody." And he shouted at everybody. And then he did the procedure. He went away. Unfortunately, next day they lost the child. Or rather, the same day probably they lost the child. The very next day, the attendants of that patient came in the same head of the department. He said, "Sir, kal wo jo doctor aaye the, wo kaun the?" And he asked, why are you asking me? He said, "Baki sab to theek tha, but look at the way he was talking to us. They were very aggressive actually." He said, "Even we knew the child will not survive. But is this how you treat a patient's family?" So sometimes unknowingly we trigger violence. And especially in a public place, if we are unmindful of the mob psychology, there's a risk of violence. And we need to know how to communicate in such sensitive situations. So if we communicate it effectively, I think the risk of violence also would go. Of course, there will be lesser conflict with your staff members, patients, and their family. See, I always tell people, we spend 8 to 10 hours in workplace. And most of our productive hours we spend at workplace. We go home to have food and then sleep and do rest of the things. So workplace environment is very important. If you have good team working with you, if you have good staff working with you, if you are rapport with your team members, with patients and their family members, you're going to go back happy. If you are in conflict with your staff members, one, attrition rate is very high. People don't hesitate resigning and moving on. If they're not happy with you, if you're not happy with the way you behave, they will leave you. And of course, your patient and their family members are also going to leave you. Earlier, patients have no choice. I remember when I was a kid, my mother used to take me to a physician. I was very, very young. I'm talking about almost 50 years ago, more than 50 years ago. He was very dominating, very aggressive. But my mother would still go to him because no, बहुत अच्छे doctor है, उनकी एक दवाई से फर्क पड़ जाता है, and we would quietly go. But today, if you misbehave with your patient, they'll not come back to you. They'll rather go and write poor reviews for you on Google also. You are a misbehaved doctor or you are a misbehaved hospital. This hospital. So if we create a good culture, I think even the conflict with the staff and patients will also go down. Of course, you will have a lot of professional satisfaction. I think this is one area we need to value. We don't value it, and that's leading to professional burnout. People are not willing to practice. People are leaving their job and going. And people are rather not wanting their children to be doctors. Earlier, I mean, every parent would aspire their child to be a doctor. But today, you ask anybody, that's because we are not enjoying the profession. And it's not just the profession for the professional satisfaction for you, for every team member, for your housekeeping staff, for your general duty assistant, for your nurses, for your fellow professionals. How many opportunities do you create for professional satisfaction? We work as a team and we have to nurture everybody. So for that, we have to create an environment where everybody is happy. When you have good, work environment, people will be happy to be with you, to work with you. Okay. My next question to you is, what are the benefits to the patient? If we communicated effectively with the patient, how do you think they will be benefited? Write in the chat box. Satisfaction, yes, definitely. Patient satisfaction will be higher, no doubt. It will build their trust, absolutely. Improve their understanding and decision-making over there. Absolutely, Michael, I think you are very right. Yeah. Clarity of treatment, yes. Reference, yes. So they will give you more reference. Maheshwari, is this what you are trying to say?
Yes, yes, Doctor.
Yeah, but that's our benefit. If they send us referral, then that's our benefit. But they will be, of course, happy and satisfied, and they'll be more information about the disease. Yes, if they'll have more information about the disease, they will participate better. They will know what is their role, and it also helps them with informed decision making for their treatment. Absolutely, I completely agree. Patient engagement, patient empowerment, they might appear new words to us, but in the time to come, they are going to be part and parcel of it. An interesting thing that I'm going to share with you, studies have shown your effective communication can change the outcome of disease. Multiple studies have shown when your communication with your patient is effective, they have better pain control. And even the modalities that you use to treat your patient respond better. Patient respond better. Not one, many studies have shown. Even in chronic conditions like diabetes, high cholesterol, hypertension, HIV, glaucoma, patients respond better to the treatment when you communicate effectively to them. So, for example, if I just tell them, see, you need to make dietary changes, you need to make lifestyle changes, that's insufficient. If I elaborate and say you are diabetic, so at one point of time, you cannot have too much. So the same diet, you will have to break in smaller meals so that your blood sugar level does not spike. So if you will take lesser amount at a time, the blood sugar level will be at a reasonable level. Similarly, for cholesterol, for hypertension, for all other diseases, when you explain them, they understand their disease, they comply. Studies have also shown that when you communicate well with your patient, even cardiac surgeries have improved outcomes. Complications like cardiac arrhythmia and other complications also decrease because of effective communication. Because when you communicate well with your patient, it improves their compliance. They take their responsibilities seriously. They take medication seriously. They make changes in their lifestyle. They work hand in hand with you. They understand the implications of their response. When you communicate well, they are happy, they are satisfied. We all know now, it's a well-known fact, when the patient is psychologically relaxed and feeling safe, the body starts healing itself. Because when you feel that I'm in a safe environment, people are nice, well-behaved, courteous, helpful, compassionate, they relax. When they relax, body releases a different set of hormones and their body starts healing. And patient satisfaction multiplies many folds. Now, finally, how do you think the organization will benefit if we all communicated effectively? Write in the chat box. Yeah, I can see 3 answers given for the previous question. Less litigation, patients and relatives education, and better medication. Absolutely. Yeah. Reputation. Yes, Shikha, I agree with you. The organization's reputation will definitely, will be improved across. Absolutely. Word of mouth. Yes, you will have more referrals, you'll have more patients coming. Better teamwork. Absolutely. And people will enjoy working staying in the team. Absolutely. Person-centered, then patient-centered. So, Michelle, can you elaborate on this?
Yeah, so I think typically when anybody gets into a hospital setting, right, they immediately, their identity gets changed from being a person to becoming a patient. So they're either referred to as the disease that they have, or the pet number, or the medical registration number, right? And very less often do they get treated as people or as person. So I think with our communication, we could be a little bit more kind and make them people.
Providing holistic care, that's what we
Yeah.
are probably trying to say.
Yeah.
Rather than treating only as a patient or a bed number or a disease, we know what other needs the patient has. Definitely. And that will be benefit to the patient. I agree with you. And then less attrition rate. Absolutely. So as an organization, I think we really need to create good work culture because it's important for us to have good work environment. There are hospitals, if we get an opportunity, we say, no, 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 we don't want to work here. There are organizations, there are hospitals. If somebody, informs us that there's a possibility of getting an opportunity to work there, we are more than happy there because we know that the work environment of that organization is good. So organizations are known for their work culture. Of course, there will be greater job satisfaction among the team members. So automatically attrition rate will go down. People will stick to their job. They would love to be there. It will enhance safety and quality for everyone, for patients as well as for the employees. It will also increase the patient experience score. They will go and write good reviews. Not only they will write good reviews, they will also stick to us. They will come back to us. They will always, uh, remain loyal to us and also, recommend to others that go to this hospital, go to this doctor, this is a good place, they have good way of functioning. So automatically the institutions will be benefited if they created a good work culture. So in nutshell, communication in healthcare is not just about niceties. We normally think communication is about, good behavior or courtesies that we are supposed to extend to the patient and family. Yes, that's part and parcel of communication. That is required. But it is the therapeutic communication that happens between you and your patient. A lot of information you need to share with your patient. What it is, why it is, what we are going to do, what options do we have, and whatever their concerns are, that need to be addressed. So that becomes a part of a therapeutic. It is the clinical communication that happens between you and your team members because healthcare is a teamwork. You can't work in silos. You require support of your team members to do to work on your patient. So we need to learn how to communicate with our team members so that those errors that we see across the healthcare go down. It is part and parcel of the treatment, and it is not optional. You can't say that, okay, I'm a good doctor, I'm a good nurse, so what if I don't communicate well? That's not true. Communicating well with the patient and their family member is part and parcel of the treatment. And implementing these practices has a direct impact on continuity of care, patient safety, and treatment. You have seen through these studies, if you communicate well, automatically patient safety will be looked after. Continuity of care will be ensured, and that will improve the treatment. So there are set protocols. Of course, a lot of them we are going to discuss in the coming session. And some you already may be practicing in your own setup. But one must learn and practice and demonstrate those protocols. And there are multiple ways to learn and implement. And communication in healthcare can be learned. That's the good news. It is not a rocket science. Anybody can learn how to communicate. Thank you. So this is briefly about topic 1. What questions do you have about whatever we have discussed in session 1?
How to make our team to be more effective communicators, though it depends upon their behavioral competencies because they come from diverse backgrounds. It's like their mannerisms. I'm just finding the good word. That all depends upon what all they have imbibed. So how to make an effective team to be a good communicating to the patients? That's the big challenge.
So Maheshwari, I think first thing is when we are selecting people, if we focus on asking good communication and interpersonal skills, there are a lot of psychometric tests available to know beforehand how good is this person in terms of interpersonal skills. There was a time we chose people based on their qualification alone. So we thought he's MBA from IIM, he's a clinician PG from here or MCH from here. So we just got impressed with their qualification. Then came a point when we realized that more than IQ, it is EQ, which plays a very big role when it comes to teamwork. Because you can't work in silos. And we have a lot of clinicians. I'm sorry I'm bringing the word clinicians. Dr. Pradeep, pardon me for bringing that up because they are top in the hierarchy. And they are the ones sometimes, if they are not very well behaved or they are not very cordial with their team, it actually trickles down to the lower level. Because if they don't respect, then automatically people working under them don't respect their lower. So there's a saying, Jasa Raja Vaisi Praja. So when you pick people for a position, and if you're choosing them just because of their qualification or their practice or their expertise, but you don't care for their communication skills, you will have time, especially I'm talking about the corporate sector, where they will come up to you and say, see, you wanted results, you wanted revenue, I've done it. Forget about my communication skills. Even if you try to raise this to them, that, sir, patients are complaining that their questions are not answered, you don't give them enough time. Even when you go on round to their room, you don't spend more than 2 minutes to them. So they will start immediately arguing with you and saying, see, I'm giving you results in terms of revenue and number of patients. I don't care what patients see. But when you are picking them, and if that's one of your requirements, that the person should have good EQ. EQ is emotional quotient. Knowing how to regulate your own emotions and knowing how to handle people so that they feel comfortable and safe with us. Because it's all about interaction with the outer world, be it their juniors, be it their fellow professionals, be it patients, be it their patients' family members. If they know how to treat people with respect and make them feel comfortable, automatically people will be happy with them. See, even today, if you have your family member to be shown to a specialist and you have 2 specialists with the same qualification, with the same experience or expertise, whom would you prefer going to?
Who is well behaved?
Who is well behaved, who is well behaved, who is respectful, who is cordial, who listens, who explains, who talks. So automatically, if these things are not there, so this is about the top people I'm saying. So whenever hospitals ask me, how do we change the culture? So I say, make sure that you choose right people. If you're only running after money, you will get money. Then forget about the etiquettes. That is one thing. Second is the rest of the people can be groomed because they can be tamed. It is very difficult to tame somebody who is a senior position. but it is easy to, manage people at the lower ranks. So make sure that you do a proper induction program for them so that you align them with the philosophy, vision, and mission of your organization. If you have clarity on your vision, mission, and philosophy of your hospital, it will not be difficult for you to translate that in the induction program. If you make it very clear to them, see, for us, patient first, patient safety first, making patient satisfied is first. It will not take very long for the staff to understand that they can't behave nonsense. They have to follow the protocol. They have to be respectful. They have to practice. That time to time training is required. See, ultimately, when people come from different walks of life, they have different knowledge, different understanding, different background. If you have a doctor or a nurse coming from a government setup to a private setup, their cultural practices will be very different. But you will have to fine tune them. You will have to induct them. You will have to align them. But expecting everybody to know everything. So time to time, assess the training needs. Take feedback very seriously when feedback of the patient and their family member. That's the best way to improve your services. A patient's feedback, a family's feedback is the best way to know what is required as part of it. And plus, let me remind you, if you preach something and you don't practice, you will never be able to change the culture. If you are rude, you are aggressive, you are misbehaved, you are arrogant with your team, don't expect your team to behave well with their juniors or with you. You have to be a good role model. If you are a good role model, automatically that energy will percolate to the lowest level. And don't hesitate doing programs even for housekeeping staff, GD. I remember I did a program for, it was security staff, housekeeping staff, and GDS for one of the hospitals. So when I was doing the program, it was a government hospital. I did around 500 training programs initially before I started working with the other, sector. Initially, I got an opportunity to do 500 training programs for government hospital. So it was Malviya Hospital, Delhi. So I did the program, and there was one participant who was just looking at me without giving me any, feedback that showed me he's listening, he's agreeing, he's understanding, he's not agreeing. I just didn't get any clue what is he wanting to say. So when I was just winding up my laptop and I was just disconnecting things. He came up to me and he literally had tears in his eyes. He said, "Ma'am, 30 साल हो गए, मुझे आज तक किसी ने नहीं बताया कि मुझे पेशेंट्स के साथ कैसे बिहेव करना। I have always been very rude with the patient. I thought I have to be like this." So just sensitizing them that patients come in pain and suffering, and we need to be more understanding of their plight and forthcoming and proactive in helping them. So you will have to bring a cultural change. Every sector will have to be sensitive. So I hope this small answer helps you. Of course, other sessions will give you a more deeper understanding of how you can inculcate these skills among your other staff. What other questions? Others?
No questions, ma'am.
Okay. Arshia, do you wish to ask anything or say anything?
And only thing is, it's easy to train the lower staff, as you said. GDAs, housekeeping, attendants, even nurses, technicians, but very difficult to change the clinicians. I've been into this sector for past 15 years, and I'm giving training to various cadres in various hospitals, including corporates, autonomous. Now I'm working with government setup. to change their thinking and their attitude, it's quite difficult. It's tedious job. I mean, sorry to say, but for clinicians, they think they knows everything. Of course, they knows everything, but they don't want to change themselves. Whenever I
Rosita,
take
I'm sorry, I'm stopping you here for a reason. I'm stopping you for a reason. I'm sorry, I normally don't interrupt, but I'm interrupting for a reason. See, if you haven't learned French, and if I speak to you in French, you'll find it difficult to understand. Let's understand from the point of view that it has not been part and parcel of their training. The status they enjoyed, the position they enjoyed, the style of communication they have been trained. For anybody and everybody, it takes time to suddenly change themselves. It is not easy. Things are changing, let me tell you. Now, younger doctors who are learning the importance of communication, I can say this with confidence because I did this study 10 years ago. I'm still doing this study. Every year before the program starts, I get 250 questionnaires answered by my students, where I try to read their attitude towards communication skills. And let me tell you, it is changing. It is changing. It will change. Change is not easy. It comes very slow, and it is not easily visible also. It takes time. That's one thing. And second thing that I want to tell you as a trainer, because you are a trainer, for me to have been successful doing this training for doctors, nurses, and for all kind of healthcare professionals, I think one of the first principle that I follow in every program is I do not find fault with people. The moment I find fault with people, they become defensive. I always say, this is the situation and we need to work on. So without targeting anybody, because you're a trainer, if that's in the background, this will come out in your training. People will not be receptive to you as a trainer. They will not like to have training by you because they'll say, you always find fault with us. What do you know what problems are we facing? Because when I initially started doing program, I did get to see the unwillingness to attend the program.
Yes.
Then I modified my content in a manner where I made them feel I am part and parcel of you. I'm not here to find fault with you or target you. I want to help you. So this is one attitude and this is one practice and principle we have to imbibe. As a trainer, I'm saying this. Otherwise, people will not accept you as. So please, we have to stop ourselves from finding fault with others. If I talk to doctors, they will say nurses don't know anything. If I talk to nurses, they will say doctors do like this. If I talk to senior doctors, they say junior doctors are very misbehaved. If I talk to junior doctors, they say senior doctors are very misbehaved. That means it is easy to point fingers at others. That's not. Second thing I say for all hospitals, see if your clinicians are not communicating for any reason, maybe workload, maybe they are not in habit of, maybe their communication skills are not good, you can always supplement it by making others communicate effectively. For example, for a couple of eye hospitals, I introduced them. It is on the behalf of Orbis International that I did a program where I developed a patient counselors program for them in two very big eye hospitals. Now they are running as regional center and they will be doing training for others. So the concept of patient counselor, I introduced to them that if the doctor does not have time to explain and answer patients' queries, can there be somebody who can give an opportunity to the patient and family to ask their questions, to clarify their doubts, to answer their questions? And if we have some bank of questions that the patients would normally ask and some standardized answers, which we know can help the patient. And those patient counselors can, save doctors' time and still send the patients out. So rather than targeting only doctors, why not improve the communication skills of nurses, front desk staff, housekeeping staff, and other like patient care coordinators. If they all communicate, even if the doctor communicates little less, others can compensate. So I hope that gives you a new perspective to the point.
Yes.
Thank you. So, Dr. Pradeep, any question from your side?
No, ma'am. I absolutely agree with you. The only thing you have to be polite but firm to make the changes.
Absolutely.
So
Absolutely.
you have to tell the consultant that these things are required, or these things has to be implemented. When you tell them 4 or 5 times, they will listen to you. Or if it is from the top management, then they will definitely listen.
Dr. Pradeep, the problem is clinicians do not like to be managed by non-clinical people, especially non-medical people. They
Very
don't like it. And
Mm.
and especially we are hiring very young people at the additional medical superintendent position, or the directors. So what happens? They refuse to just listen to them. So of course, as I said, slowly things will change, and if we make the whole working process oriented rather than person oriented, then you will be able to automatically bring change in this system. I think that's how I hope things will change in the time to come.
Dr. Indra, I have a thought here.
Sure.
Can I say something?
Sure, please.
Yeah, I mean, just now when you said that, the clinicians do not want to listen to non-clinicians or to the people who are not from the medical background. I mean, so I work in the industry and I have like 18 years of experience. And sometimes I have to work with people, or, somebody who's leading a project is someone who's junior to me, right? Who might not have that kind of level of experience.
Mm.
And sometimes it ticks me off when I'm being instructed, given, uh, a lot of instructions by that person. So there are two ways of managing, somebody who might have more experience or is senior in understanding of, for example, for clinicians, if we say, their educational qualifications are much larger, and also, their experience might be much more. So could it be, instead of it being that it's about having that qualification, could the issue be, that feeling of being given too many instructions, or, that interpersonal relationship? For example, for me, if I'm working with a person who treats me as a peer, who understands,
Yeah.
and, the communication is more at an equal level, it's much easier. So,
It's all about EQ. If
yeah,
you
so
know
that's
how
what
to
I'm
तुम अपना
thinking.
शुरू करो, मैं आ जाऊंगा. डिस्कशन चल रहा है, 5-10 मिनट वाइंड अप है वैसे.
Dr. Pradeep, can I mute your device? I know
Sorry,
it's
sorry.
no, it's okay. It's all right. We are just ending. Yeah, I'm just sharing the feedback form, and I request all of you to share your feedback before we close. Give me 1 second to share the feedback form. So I completely agree with you, Arshia, that it's all about interpersonal communication.
Yeah.
A study by Harvard says that your communication and interpersonal skills amount for 85% of your personal and professional success. That's the importance of skills. So I think it's very important. And we'll be talking about it at length. Don't worry. I will also be sharing the skills how to handle those situations when people cross their line, or when they don't behave well and they're aggressive with you. How do you communicate with them and make them understand your point of view? We are going to do everything through learning by doing. So don't worry, we'll be discussing. So I've shared the uh, feedback form. I request all of you to quickly finish the feedback before we close this session. I hope you are able to click it.
Yes.
I have received 4 responses. One more to go, I think. So meanwhile, one more question for the group. Uh, Next week, I am traveling to Hyderabad for a program on 12th. So can we have this session on 11th, if that's okay with you? That is Tuesday.
Yes.
Dr. Indra, 11th could be difficult for me. Actually, I'm also traveling. So
Okay.
I might reach there by, so I'm going out of India. So I'll reach on 11th. Yeah. So if could we do it on 13th instead?
Actually, I'm traveling on 12th, and the program is on 13th, 14th, and 15th. 3 days program. That's the challenge. Or does 10th suit you?
No, 10th. Okay, then maybe no, because I'm traveling on 10th night only. I'll
Okay.
reach there on 11th. Okay, I think then 11th is better. If there's no other date, I'll try to manage. If I'm not able to attend, then maybe I'll see the
I'm really
recording.
sorry. I normally don't change the date, but it's something that they were discussing with me for the last 10 days, and suddenly they said we want it in this week itself. So when are you coming back?
I'll be coming back in the next week. So I'll be traveling on the following week. In the following week, I'll be traveling on Thursday. So
Oh.
Thursday is one day if we could avoid the session.
We will do. We'll definitely make sure that we don't do a program on the day when you are traveling. But if it is possible and if you can attend on 11th,
Okay, I think let me try because I would have reached there by 11th. So in
Yeah.
any case, it is late in the day, so should be doable.
Thank you. For rest, others, are you okay with the change?
Yes.
Okay.
Okay.
Yes.
Thank you. So I'll message in the group that the next session will be on Tuesday. And let me first get the confirmation in case if there's some change in the this thing, then we'll go ahead with the same day, that is Wednesday. But in case if I'm traveling, then I'll request all of you to adjust for me. Thank
Thank you,
you.
ma'am.
Thank
So I think we'll close this session here. Thank you so much. It's quite late for all of you. Thank you for being there. Bye-bye. Good night.